so we'll have a custom-made night guard, and we can either scan your mouth or we can take impressions. Today in 2022, with all the technology available, we'll use an intraoral scanner. Well, we'll take a picture of the teeth, and then we'll send that to the laboratory to have them fabricate a night guard. And then when that comes back, we'll fit it to see how it fits over the patient's teeth, and then use that to allow them to sleep with it, so that that'll help reduce some of that pressure and tension onto the teeth. And so that's one way of treating TMJ disorders. And that's probably the most common recommendation, is making a night guard. And so we recommend night guards for a lot of our patients, and even patients who have completed full mouth rehabilitation or implant rehabilitation will always recommend a night guard, because we want to protect the teeth, we want to protect the implants, we want to protect whatever crowns and veneers that we made for our patients, and so that way it will last a long, long time. Another way of treating TMJ disorder, temporomandibular joint disorder, is prescribing Botox, meaning we can inject Botox right into the temporomandibular joint, into the masseter muscle, into the joint area. And injecting Botox, it's a neurotoxin that will help reduce the muscular activity of the muscle that's causing the contraction of the joint area, right? The masseter muscle causing contraction. So that will help reduce the amount of force, amount of contraction, because the neurotoxin is going to help reduce that muscle activity. And so that's what happens with facial aesthetics. When patients go for Botox, it's not a permanent solution, but it's a temporary solution to help reduce fine lines and wrinkles. And so we actually do some Botox here as well. So we help treat patients with TMJ disorders, and it actually kills two birds with one stone, meaning it not only alleviates the pressure and the tension going to the joint area, but it actually slims down the jawline. So you're actually getting the aesthetics and function benefits from Botox. And so we'll prescribe Botox, and we'll recommend Botox for patients who have TMJ disorders, who are clenching, grinding, who have a lot of wear. We'll suggest, hey, you have these a lot of worn teeth. One way to help reduce wearing teeth and preventing wear in the future is making a night guard, and you may want to consider getting some Botox injections into the masseter muscle. And so we do a lot of Botox patients into the masseter to help reduce that pressure, tension going to the muscles, help reduce some of the muscular activity, so that way you have less forces, less pressure going to the overall dentition. And so not only for function, but even aesthetics, to help slim the jawline, Botox can kind of counter both conditions at once. So first line of treatment that we would recommend it would be a night guard. The second line of treatment that we would recommend would be Botox injections. And usually with those two combinations, it will help reduce a lot of the chewing or grinding and clenching that brings that discomfort to the joint area. Some other treatment recommendations that we would recommend to our patients is you can do warm compresses. Many times patients who clench or grind their teeth kind of will feel the tension, will feel or may get some headaches. And so you can reduce the headaches by taking ibuprofen, anti-inflammatory. That will help reduce the headaches. It'll help reduce the muscular activity, the inflammation to the joint area, and using warm compresses, warm heat compresses to the joint area will also help alleviate some of that pressure, because it's going to stimulate circulation to the area. So warm compresses, over-the-counter anti-inflammatories, usually ibuprofen, and usually we will recommend 600 milligrams every 4 to 6 hours. Make sure you don't take more than 3,200 milligrams of ibuprofen. So we'll recommend 4 times a day, 600 milligrams of ibuprofen, which is about 2,400 milligrams of ibuprofen, and that will usually help alleviate a lot of that discomfort. So anti-inflammatories, warm compresses, and not to chew on those hard, chewy foods. No beef jerkies, no hard meats. So, being mindful of the types of foods you chew, being mindful of the foods that you eat will also help reduce some of that tension and pressure going to the joint areas. So hopefully this will help answer some of the questions for patients who have some joint discomfort, joint pain, joint disorders, just some recommendations that we can recommend for our patients in terms of night guard and using Botox, and also, changing a little bit of the daily diet patterns, softer foods, using warm compresses and anti-inflammatories. And if you're in the Flushing area, you want to come by and chat with us, we would be more than happy to welcome you and kind of give you our thoughts and our recommendations. Hopefully these tips will help you kind of maybe find a solution that can help you better solve and treat those conditions. So coming to you from New York Dental Solutions here in New York, Dr. Jason Kim, thanks for joining us, and we hope to see you soon again. Bye-bye.